The following is a local resident producers program. The program content is the sole responsibility of the producer and does not necessarily reflect the views or policies of CATV2, Oshkosh Community Access Television, the City of Oshkosh, the Oshkosh Cable Television Advisory Commission, or Time Warner Cable.
Hi everyone, welcome to another edition of Eye on Oshkosh. I'm Cheryl Hentz along with former Oshkosh Mayor and former City Councilwoman Melanie Bloechl. Currently within the Oshkosh Area School District there is a huge controversy that has been abounding for at least a couple of months, probably even longer than that. The controversy has to do with the Oshkosh Paraprofessional Education Association and their bargaining attempts with the Oshkosh School Board to try and get what they feel is a reasonable contract. And here to talk with us about this issue on this edition is Lynn Binder. She is the president of the OPEA. Do you pronounce that OPE?
Yeah. No, OPEA.
Okay. And also Candy Weber, Candy is a board member, correct?
No, I'm a vice president.
A vice president, okay. So why don't we start with you ladies telling us a little bit of, first of all, what your organization is, what the union is, what paraprofessionals do. I think most people know, but in case they don't, why don't we find out a little bit about what paraprofessionals do in our school, and then from there we can talk about, you know, how we've gotten to the point that we're at now from the very first negotiation that you had with the school board.
Well, we could talk for an hour on what we do, but there's such a variety of people in our unit. We have teacher assistants in various programs throughout our district, and we have hearing interpreters, which interpret for the hearing impaired.
Deaf and hard of hearing.
Hard of hearing. I'm a health assistant and also a licensed practical nurse for the school district. I not only work in the office and do various things, along with immunization records and state reports and vision and hearing screenings and such. But also our diabetics that we have in the district, we do, whether they need insulin or whatever, we're there for that. G-tube feedings for our special needs children. We have vision interpreters. We have the ESL interpreters that do translations for either our Hmong or our Spanish-speaking students.
They're called ELL now.
ELL, yes.
English language learners,
Yes.
I guess.
Good, because I really never liked that English as a second language, because we are in the United States. This really isn't a second language. This is the first.
Yes,
Okay.
they're English language
learners. And we have so very, various.
A large population.
We have our media assistants, which help our media specialists in the libraries or the media centers.
CBD,
Yes. Our
CBS.
cognitive disability borderline and our cognitive disability multiple severe
MS.
and those assistants with severely handicapped children. The LD
Office
learning
assistants.
Yes, learning disability.
EBD.
So essentially, you are the teacher's right hand.
Many times we even
Many times.
assist so much in the office that we're running the office if the secretary isn't there, or they're second-hand mans, for helping the secretaries, whether they're there or
Okay.
on.
Well, at present time, a couple weeks before this show airs, there was a rally that was held, and it was organized, I think, pretty much by Steve Dito, the president of the Winnebago County Labor Council. And it was because of this unfair wage issue that seems to be going on. Do we have it understood correctly, ladies, that the school board made an offer, a contract offer, and then when you accepted it, they took it away. Is that a correct interpretation of what's been going on?
First of all, the picketing that we did was really not to say, we've given you a fair offer or you've given us a not fair offer. It was to say that in the attempts to bargain with you, you closed the door on bargaining with us. They chose to close the door on bargaining with us. They chose to file an objection to WERC, and they chose to file for arbitration. We were working through a mediator at the time. We had, and we had hoped that we'd be able to settle some things through mediation, and they just decided it wasn't worth working through.
I have a question about that. There are very few times that administrators ever want to go to meet-arb. Why would they ever want to close the door on face-to-face negotiations and go to meet-arb unless your benchmarks, which for people who don't know exactly what we're talking about, when you do union negotiations, many of those parameters are set by benchmarks from like communities. What other people are getting paid, what their benefits are, all those kinds of associated type things are usually brought into the mix. And so very few times do administrators, I know the city has never been very excited about going to meet-arb. I'm trying to understand why meet-arb would be, why they would consider that would be something that would be beneficial for the community, because in meet-arb it's an either-or situation.
Correct.
There's never a meeting of the minds or a, gee, is there some way that we can come to a happy medium? It is either your proposal or it's the school board's proposal. So how does that, are the benchmarks, are you guys way off on what you're asking for as far as the benchmarks in other communities for like positions?
Oh, I believe the reason they did what they did is because they were not willing at all to give up the issue of the 0.5 to 0.8 people and benefits. And they also we are having some difficulty coming to terms with the NCLB language and how that would affect us as a unit.
NCLB, can you define that?
Well, that's the No Child Left Behind Act.
Okay.
And how that will affect us as a unit. With all the new laws and regulations that are coming with that, our assistants need to meet certain criteria in order to be employed.
Okay.
And we were trying to get some language that would protect us. They didn't want to protect us. It was just, it's such a new thing, this new No Child Left Behind thing, that none of us really know how it's going to turn out. So we just wanted our unit protected, that somehow if something came up in the future with the laws and how they changed, that our employment would be protected.
Now, you talked about 0.5, 0.8. Those are considered time positions. But again, we're talking to a community that might not understand 0.5, 0.8. So we have to be a little bit more specific. 0.5 is considered half-time.
Correct.
So it would be a half-time position versus a FTE, which is a full-time equivalent.
That's
correct?
Right. That's
Correct.
right.
What is the 0.8 then? Is that
It's 8/10 of a full-time
Full-time position.
Okay. And presently, your paraprofessionals receive full benefits at 0.8, correct?
That's correct.
From 0.5.
From
up.
0.5 up to 0.8. So at halftime, at a halftime position, 0.5 to 0.8, you still qualify for benefits.
Correct.
Anywhere in between there. And when you say 0.8, you're talking about 3.5 hours a day?
No, not 0.8.
Okay, so
Point-
0.5.
0.5 would
is
be.
about,
That's
so,
correct.
So if you work 3.5 hours a day, your full benefits as far as health, dental, vision, life insurance, disability,
Seniority.
seniority, you get all those benefits.
Okay.
All right. Now, when we talk about benefits, there is a smorgasbord out there of benefits available. People don't understand, okay, does this mean that you have 100% coverage? Do you have WEA insurance?
Yes.
Like
We have
all the
WEA
teachers?
insurance.
Yes,
So
that's
you have the
correct.
same insurance as the teachers have?
We have WEA insurance, and we now have what is called the point of service plan through
Okay.
WEA,
Okay.
which is, you could kind of say like an HMO, where we have to go to a specific
Sure.
organization for our health care in
Control.
order to have the
The 100%
the
coverage.
fuller coverage.
If you decide to go outside your plan, you have
Right,
an 80/20,
exactly,
or you have to
exactly.
but you don't have any front-end deductibles on that. It's from the time you start going to the doctor, you don't have to pay anything. You pay 5% of your premium, is what I understand.
Correct. We
That's
have a
correct.
deductible also.
You do have
Even
a
with
front-end
the point of
deductible?
yes, even
What
with
is
the point
your
of service.
What is your deductible on your services?
Our point of service plan, we just started it, so let me, there is,
If you stay in network,
if you stay in network, there is still a deductible. We met it because when we switched from MCP to point of service, most of us had met it already.
okay, I don't know that.
And there is, and you know off the top of
We
my
also
head.
changed into a different drug card, which
Yes.
is, we used to have a 05 drug card.
And it's 0520.
Now we have a 0520 drug
Which
card.
means you either pay nothing, $5 or $20, depending on
Depending
where
on
you fall
where
on the
they're at.
prescriptions,
That's
if they're
correct.
name brand generic, if they're off the charts, what have you.
That's
And to
correct.
clarify, we switched this to this, more cost-saving insurance plan on our own during this negotiations.
Even after they had filed for arbitration.
We did this
as
on
a-
our own to help out the
As a
district.
show of good faith in negotiations.
Well, now I did some research, and the insurance premiums for this plan are $1,054.12 per month for each person in the plan. So you that have insurance
As a family plan?
as a family plan are being charged, the district's being charged $1,054.12.
That's not the
That was the
information I
managed
have.
care plan that we
That's
had.
on the old
We went to
plan
the,
that we went.
the more cost-saving one.
And what is the cost to,
The cost to the district is $947.44 is what I have.
$947.44?
That's correct.
And you're paying 5% of that.
5%.
No, the cost of the plan is $997. After you take our 5%, the cost to the district is $947.44.
Okay. So you're paying roughly about $50 a month for your full
That's
benefits.
Right. That's right.
Okay. And then you get vision and you get dental?
No, we don't
No
have
vision.
vision.
None of those?
We don't have vision.
We have dental, but our
Dental.
plan is not comparable to the teachers
Okay.
or the administrators.
Ours doesn't cover like orthodontia.
It does. It's a
And the reason that I'm going here is because, of course, in Oshkosh, there have been so many people that have lost their jobs. Factory workers, people, it's just gone. They're gone. And I don't know where everybody thinks these people are going to find jobs or what they're going to do, but they have no health insurance at all. It's just absolutely gone. 30 years of service, they're gone. Nobody seems to care. It's a little difficult to look at you two ladies saying, we have people who are working half-time jobs that can start at 3.5 hours a day with full benefits. And the district, these same people who lost their jobs with no insurance are going to have to pay for that. So I guess what I'm wondering is, how do you rationalize in these times, in this community right now, how that can be perceived as the ability to pay in a community that's suffering?
Can I give you just a little history, though?
Sure, absolutely. That's why I'm asking you.
We have a total of 221 assistants.
Okay?
185 assistants are full-time. Our less than full-time assistants, according to this total 11, I counted 15. I've been working in the district for 27 years. The .5 and above benefits were drawn up in our initial contract when I was on the negotiating board for the initial contract that was started, I would say, back in the late 70s, early 80s, as our very first time we ever organized and had a contract. Those benefits were put in there because it mirrored the teacher plan, and they felt that because we were more in the educational part of they took a lot of the teacher contract and put it in ours. Now, I don't rationalize that they should give 0.5 and above benefits, but since that time, since probably the early 90s, they've now come to a policy where they hire a lot of 0.49s, 0.48s. They're telling assistants they cannot work 5 minutes more a day or they will be in danger of having to give them benefits. Okay, that's fine. The district is the one who chooses the full-time equivalent positions. They don't have to hire 0.6 people. They can take a 0.3 that they have and combine it with a 0.6. They could say, we'll never hire a 0.5 to 0.8 person. And make that a 0.9. We won't pay benefits for a 0.6 person. They could do that. They choose the full-time equivalent. We don't choose that. And
So you would be willing to give those, what happens to those people who are 0.5 to 0.8 if they want to get rid of those? I mean, I guess what I'm saying is if your argument is, or your statement is, I don't want to say you're arguing because you're just trying to point out facts. If you're saying that that's not the most important part of the negotiation,
there are
more important things, would you be willing to give up benefits for the 0.5 to 0.8 people?
We
And
were
let them be
willing
for
to
the full-time?
grandfather them in, for now. Those few people that we have, 11 is
no,
we figured
no, it's not
8.
11, it's 8.
8 according to what,
So
what
there's
we have,
8
yes.
half-time people that fall between
That
the
fall
0.5
between that
and
area.
the 0.8.
And we were willing to grandfather that in one of our contract negotiation
We were willing to
proposals.
say, okay, from this point on, anybody you hire at 0.5, 0.6, 0.7, we can do prorated benefits for.
Mm-hmm.
We needed to protect those 8 people. We also need to protect what's going to happen to the rest of us. Are they going to say, okay, we don't need you, now we only need you 0.79, at 0.79 full-time equivalent? It was in negotiations, that's what you do. You try to protect what you have. I mean, this was a let's talk about this kind of thing. There wasn't any talking. That's really what they wanted, and they weren't going to.
From the first time. I mean, from the first proposal, they proposed this. And we had decided we would grandfather those in. And so that all of us that are now, so that we would, even us full-time people, would now become 0.79.
What,
And they refused.
what is the main bone of contention here? The thing that's breaking the back between the two sides? What are they asking you to give up?
That.
Okay.
And we're so afraid that all of us will become 0.79. That all of a sudden they're going to say, we don't need you quite as many hours as we used to, so let's pull you down. They are in control of the FTE, as Candy said. So they could reduce us at any point. Yes, it'd be, harder for the teachers.
Well,
but
we do have some protections for them, for reductions, like we'd have our, the layoff type things, that normal layoff type protections in your contract if that happened. But you can understand that if every new position gets hired at a 0.75, that erodes the base of your, of your unit. Then you've got a group of people that don't have benefits, and your group of people with benefits get smaller and smaller, and you lose any kind of bargaining power you have at all. So,
Well, I realize that this is, public sector as opposed to private sector, but, we saw just in the last couple of years, look what Axel Tech did with their people, trying to break the back of the union. There's a contract out there, and they just dishonor it, basically. Here, I understand you're working without a contract. You're trying to keep what they've already offered rather than be regressive. You're trying to keep at least what you have. There have been some editorials written, and I thought you could address them for us. Amy Weinsheim, who's not only a member of the school board, but she's on the negotiating committee. She had a letter to the editor in the paper in this last week, and she was citing a bunch of facts and figures, and the one point that I want to make is her figures on some of these things I believe are wrong. She gave the impression that you pretty much have to work 40 hours a week in order to be full-time. I know of a tremendous amount of jobs, albeit not in the public sector, but rather in the private sector, where if you work 30 hours a week, you're considered full-time with full-time benefits. There are some where you can get partial benefits at even 20 hours a week. So I took some umbrage, I guess, a little bit with her letter, but why don't we just address some of these points that she made in the letter? What really stuck out to you all?
Well, I know she was angry at one of our paras that had written in about not having somebody come and job shadow her. That is something that the staff development committee, the para staff development committee, has done, trying to get administrators and board members to follow us around to see what we do for a day. She did volunteer and do it. The person that did write in to say that she did volunteer and nobody showed up, Amy called her a liar. She did volunteer and nobody did show up. I don't think that's lying. I mean, she did. It was, a year that there was very few board members that signed up that year, whether they were busy or just not interested. I feel sorry for this person that she ridiculed in the paper, because this gal wasn't lying. I mean, she did want somebody to job shadow and see what she did, and nobody showed up to do that.
She used the beginning wage and the ending wage there as far as what you start at and what some of the top people make. I am the highest paid person in our unit right now. I'm an educational interpreter for the deaf, and I went to school for 2 years to do that, in order to learn how to do that. And I have rigorous credits rigorous things that control me to make sure that I'm an acceptable person on the job. I will be having to go in front of a state board of people to show them my skills, to prove that I'm a skilled person. Now, I'm not tooting my horn or anything here, but in the mid-1990s, the school district was having some problems with the Department of Public Instruction. They were getting some pressure because they were in non-compliance as far as interpreters for the deaf go. The school district negotiated for 4 years to have $1 increase for each of those 4 years for educational interpreters for the deaf, because they were getting the squeeze from Department of Public Instruction. We didn't say to them, you need to give these people more money. They came to us and said, we have to give these people more money. We can't hire anybody, so we need to give these people more money. So you put that as a top wage in an article from Amy, that looks as if we're like totally overpaid, and that there's no reason for that. There's reasons that, for all of that stuff. There's history behind it. And it sounded as if there wasn't. It sounded as if we negotiated that huge wage, and which isn't that huge.
The major portion of our unit are under the assistants. At the 2002-2003, where we stand right now, because we haven't, come to a contract, they make $981 base pay. Now, you go down the line, 0 to 5, 6 to 10, you go all the way down. The most somebody in that category, which is probably 75%, if not more, of our unit, is only $981 plus 87 cents after 25 years of service.
It's not very much.
Which understand, is $10, I believe.
We understand our benefits and they are very important to us. We don't want to lose that, because the major portion of our members, that's what they make. Do you think you're going to get anybody at 0.79 to work for that without the benefits? They're not going to. You're not.
But I think maybe what they're thinking is if we're not paying for these really expensive benefits for part-time, quote-unquote, part-time employees, we can feed that money back into the salaries for the full-time employees.
We said 8. Did we say 8, or is that how many we had? I
think that's what you said.
That's
you
what
8.
That's what we found as of today when we.
If we if we got rid of those insurance benefits, and what they were suggesting wasn't that we totally didn't give them, they were going to be paid on a prorated basis. At $10,000 a year, let's just round this off, for insurance benefit costs, a prorated 0.6 person gets 0.6 of that. That's $6,000. So you take that, and let's say all of those 8 were 0.6. They're talking about saving $48,000. We, out of good faith, gave up the Cadillac, as they want to call it, or incredible health insurance benefits, to the tune of $135 loss on insurance benefits in good faith without a contract, which saves the district $135 a month on each and every assistant that has health insurance. If you take the $135 a month that they're saving, that we gave them in good faith so we could continue to bargain, you multiply that times the amount of assistants using that, they're saving close to $20,000 a month on a good faith bargain thing that we did.
And I understand the way that your rationalization works, but I think and I'm just talking from a person who's been on the other side of that table, in a budget crisis, we have this wonderful No Child Left Behind, which I'm sorry, I think is a lot of crap, okay? There is no money that's backing this.
Nothing.
The feds don't give you any money for more of these mandates.
Correct.
And let's be very honest, because, political correctness has never been my long suit. You're dealing with some of the toughest kids as paraprofessionals. These are cognitively challenged children, emotionally challenged children, physically challenged children. Okay? Now, when you have the No Child Left Behind mandate, that means the teachers are under a humongous amount of pressure that every one of these children, challenged or not, has to meet certain criteria. They have to be run through the system, and they have to pass all the tests, and everybody has to come out great. That is not, in this world, going to happen when every child is not the same. Of course, we don't want to leave anybody behind. We've all been parents, we're all aunts, we're all uncles, we care about our kids. There's not a single one of us taxpayers that wants to leave our kids behind. But this mandate is absolutely ridiculous. It cannot be physically or financially accomplished without some help. But until we demand help from the federal government so that money starts trickling down, we have state legislators who are taking away shared revenue. They're not funding the schools appropriately. Where is this money going to come from? And bottom line, when it rolls downhill, part-time employees are going to be the one that are going to get the axe.
Why do they have to hit the lowest man on the totem pole?
Well, and you know what? I agree with you, because I looked at some of the information that you actually sent over with some of these administrators' salaries. They're enough to choke a horse. And quite frankly, if it were me, and I've actually suggested this in the past again because I'm so incredibly worried about being popular, is freezing administrative salaries. Freezing them. Because if there's not enough money to provide decent wages and decent benefits for all, then there can't be a whole lot of fat floating on the top either for everybody else.
Correct.
And unfortunately, the way the system has been designed is that they have these steps or these matrices that automatically the administrators just slide into these positions by virtue of years of service, by virtue of education. But here's my problem. When your paraprofessional union negotiates and the teachers negotiate, nobody's stopping this cycle of, you know what, this isn't right. Because what's happening here is nobody wants to step on the other union's toes. Do you know what I mean? The administrators are getting these gargantuan, when you look at percentages versus what your percentages are, they're gigantic.
Correct.
Plus all the benefits, plus the vacation time and, you know, disability, and I mean, it's ridiculous. But if this has got to stop someplace. And do I think that the school board needs to address those administrative salaries? Absolutely. Absolutely, as well as the benefits. It is the taxpayer's ability to pay, and that's where I'm going. It's not just you guys. It's the whole system that I think the taxpayers have kind of come to the point where it's like, we're not getting these kind of benefits. We might not have a job tomorrow. This community is really, really suffering. But then, you know, you are going to be, see, this is the bad part. You guys are the low man on the totem pole, but you're carrying the picket signs. You're the ones who are coming out and saying, we want benefits, we want benefits. And you know what? You guys are taking the shots for the whole, every union, every administrator. The entire community is PO'd about this Cadillac plan that the schools and the teachers and everybody are getting. And you guys are taking the shots for all of them. Because you know why? Because when you brought it up and you're talking about part-time benefits and all these kinds of things, people are going, what? And then they start paying attention to all these other pieces. But right now, you're the ones who have the negotiations on the table, so you're going to get the shots for everybody.
And the NTA just did settle. They didn't go to point of service by themselves. I mean, it was a contract settlement. They got the wages back in their paychecks. Were they asked to go? They're lower. They're under 1.0 FTE people. Were they asked to decrease? No.
And why is that?
Yeah,
I
it seems
don't
to me like if they want one union to have its members take a hit,
Right.
then they should all be willing to take a hit. I wanted to ask you ladies about, you know, I didn't have much of a chance to look over some of these things on the administrators' benefits packages, but we were glancing at it a little bit before. Are we understanding and interpreting this correctly, that some of these administrators are getting like 8 weeks of vacation a year? And if so, is that in addition to having summers off, or do they not have summers off? Do administrators have to be there year-round?
That, I believe, is including the summer months. If you're talking about, I'm thinking principals and,
Yes.
and
Yeah.
stuff like that, I believe that
So
comes
this-
out of the summertime, yes.
Out of the summertime, so it's not in addition to?
They have,
No.
Yeah, they
Okay.
have vacation
All right.
time.
Well, that makes
No.
me feel a little better about
Yeah, because I
that.
was feeling a little nauseous when I saw that.
Can I just say one thing? We're talking total package. They keep bringing these huge numbers out of an increase that we want.
Point.
We wanted to roll the insurance savings that I told you about into our wages so that we can take that $981 and make it look a little better to our members. I'm going to round some figures off to just give you an idea of what really happens in a package type thing. If our paraprofessionals, and I'm going to round these off just to make $10,000 a year annually, and their benefits cost $10,000 a year annually, that's a $20,000 cost to the district. A package on that, a 4% package on that, is $800. Now, you take that $800 and you take the $700, the 7% insurance increases off of that. 7% on $10,000 is $700. You subtract that from that $800, we get a net increase of $100 in a package proposal.
And you're saying taking the $700 off the package
Off
because
the
you
package.
voluntarily went to the cheaper
Plan.
health care plan. Is that why you're taking that money off of there?
No. You'd have to subtract it in when you do a package proposal. The cost increase of insurances goes up. I'm talking if we didn't change insurances, if we kept the same insurance, and the insurance went up 7%, you'd take that up, we'd keep our old insurance, and we'd get a $100 increase a year. So we said, okay, we'll take lesser insurance, but we need to get more than $100 a year, okay? So, but now let's go to the administrators. Let's say their average salary is $70,000. You take $10,000 insurance costs on that. They cost the district $80,000. 4% of that is $3,200. Okay? Now you subtract the insurance increases. That's where a $2,500 difference. So they get a $2,500 salary increase.
Okay.
We get $100. So what happens? The low people on the totem pole, plus I pay 25% taxes on my $100, so now I have only an increase of $75. We get a $75 increase, and they get a $2,500 increase minus their 25%. So the gap gets bigger and bigger.
I totally agree with you. So my question
It's
is,
just not
because you
fair.
guys are taxpayers in this community too. I mean, it's not just that you're getting good benefits from the community. You work here, you live here, you pay taxes here, correct? So you're paying into your own system. On top of everything else, you're paying property taxes that support your salaries and your benefits, right? But what I want to know is, you're upset, obviously, about how the administrators and the teachers, these inequities in the system. You're upset by that. But how come none of you guys are going forward and saying, hey, this was just ratified. The administrator salaries were just ratified, the teacher salaries. How come nobody comes up and says, you know what, this is wrong? You want us to take a hit. You don't want us to have these part-time employees have benefits, but you just ratified a contract that allowed the teachers to do the same thing. How is this equitable? I didn't see you guys doing that. How come?
We do.
We can't.
You can't go to the school board and say that.
We've gone to our human resource director at our
No.
committee
How
meetings.
come you're not going on TV to the school board and saying this is wrong? Politics, correct?
Yes.
Am I
Well,
correct? It's politics.
They don't want to hear about everything. They're dealing with our unit and our unit only. You can't bring up what while you're negotiating. They don't want to hear about the non-teaching association. They don't want to hear about the administrator. They want to talk about you.
Okay, but what I'm saying is, as a taxpayer of this community, separate yourself from your position within the school system. As a taxpayer, also knowing what you know as an employee, and you're watching these contracts being ratified prior to yours, and you've been working without a contract for as long as you have, and this contract just was ratified with the teachers, seeing these enormous jumps, how come you guys aren't going to the school board as private citizens, as taxpayers, with the knowledge that you have of your bargaining units and knowing what they've wanted to do to you, and not fighting that if it was fair to knock you guys down here, why wouldn't they want that same set of circumstances across the board? Why would that discussion be outlandish?
Lynn and I both sat in on the negotiations for the teachers unit. It was an interesting thing to set it. We've done this now for 2 negotiations, both of us. It's very interesting. I have the utmost respect for the teachers, and as a taxpayer, I differ from you in that I don't mind putting money into education. My husband owns a business in town. He pays taxes. I am probably much more liberal in that respect, that I don't mind paying our teachers a fair wage if they're doing what. We have a wonderful school district. The state of Wisconsin has the best school districts as overall of most of the 50 states. We should really be proud of our school districts, our teachers, and the employees. So I do differ from you in that. But
I don't think we differ
negotiations
there. I think we agree on that. My concern is how long are we going to be able to maintain those wonderful schools and that level if we don't get a handle on costs and realistic expectations of the taxpayers paying the bill. Because these are not endless sums of money that keep coming. And all I'm saying is that we do have good teachers, we do have good schools, but we need to be realistic about the taxpayers' ability to continue to support maybe unrealistic expectations by employees. And you've already stated that these administrative salaries are out of line. They're out of line. I mean, I'm looking at them and I don't disagree with you.
And the argument we got was that Oshkosh was having a hard time hiring new administrators, maintaining their administrators.
When we did question
That's
it. We
what
did
we did.
question it. I mean,
That's
it's
the
not that
argument.
we've sat back and said nothing. And I agree with Candy. I mean, we've joined WEAC with the teachers, and it has been a wonderful union with us. We're on their negotiating team, they're on our negotiating team. We share things. Administration didn't like that, board didn't like that when we first started. They wanted to know why we were sitting there, and they questioned that. They didn't want us sharing information. This last negotiation that they had for the OEA was wonderful. I mean, they had called consensus bargaining. They had a mediator in to kind of, cool the jets when it got really hot, and it was wonderful. And we went into our negotiating, and we got the eyes rolling, and
The atmosphere was immediately
totally
totally
by
different.
people that you were negotiating with, by
the
people
board.
from
By
the
the
school
two
board?
By
the
the
two
school
school
board.
board members that negotiated with us were Ben Schneider and Amy Weinsheim, versus the teachers had Tom McDermott, Dennis Kavanaugh, but they also had other people sitting in on their negotiations that were not happy with some of the things that were going on. So
Well, I can appreciate what you're saying. If Amy Weinsheim was one of the people who was, because she did that at a meeting that I was chairing, and she didn't like my position, so she did that number to me too. So I can appreciate what you experienced there. Candy, you had put out a figure before, and I didn't quite understand. It was $48,000. Is that what the district was saving, or would be saving, if you were willing to make this concession?
I said if there's 8 employees that were all .6, and if that .6 they paid a prorated .6, which they wanted to. That's one of the things they said is we'll pay prorated benefits. Okay, that would mean if an insurance policy costs $10,000 a year, and I'm just rounding figures
Sure.
off so we can
Sure.
just, that employee would cost the district $6,000 a year. Well, let's say that all those 8 were .6 people. They would be saving $48,000 by us kicking those 8 people in the pants and not worrying about them. My feeling is, if you don't like this, figure out a way not to do it. If you don't want to hire .6 people, don't put them out there. Figure out a way to make .8 or .9 positions if that's what you want. But we have people that pay dues that we need to protect. It's as simple as that.
I had talked with Ben Schneider, because we're going to have him on a future show talking about this, but he had indicated to me that there was not an offer that had been put out there and accepted and then taken back by the school board. Is that accurate? Or, because that was not the impression that I got from Steve Dito's press release.
Now, Lynn has a lot of information, but before she answers that, that's the way negotiations go. We'll give you this. You've been in there, you said. So at one point, she's going to tell you what they gave us, what we asked for. But whether it was given, we never came together on it. You know what I'm saying?
Okay, so there was never actually an offer made and accepted and then taken back.
Yeah, because
Kind of like an Indian giver sort of thing.
Right.
It
It
wasn't
isn't like that. It's
Okay.
here's our offer. You take it, and then we say, well, we'll take it with this, with these changes.
Right.
Okay.
Correct. It wasn't the exact. Their proposal as of May 12th of '04 was, of course, the point of service plan that we were negotiating, the 95 that they would pay, we'd pay the 5. As of the July 1st, 2004 at this time, which was, right after the May of '04 when they proposed this, that it would be the .8 or greater. In order to be eligible for hospitalization and medical benefits and dental benefits, you had to be .8 or over. They also offered us, at that time, the '03-04, 47 cents per hour across the board, and $1.20
In the second year.
in the second year, the '04-05 one. And then pretty much the same, we wanted an extra year or an extra day of a paid vacation. We didn't want to lose a lot of days because, of course, that's our gross wages. So you lose too much, and what's the sense? Because you end up, losing in the long run anyway. But they pretty much was what we had kind of, and then in May 12th, we proposed that we would grandfather these people in. Instead of just saying you don't have any, we didn't want to, really, actually screw our members. The point in between the .5 and the .79. So we said we'd grandfather them in. We also said the same. We agreed to that wage. That was great. We wanted to do it. And then came along May 27th of '04. They again said the same thing with the .8. They did not want to grandfather anybody in. And all of a sudden, we were 47 cents the first year.
Which it was before, Lynn.
And then it went down to 83 cents the second year.
With relatively no changes in what they were
Still the point
proposing
of service, the same stuff. I mean,
a few weeks before.
so that's what probably Steve was talking about. I mean, it was pretty much, if we could have grandfathered them in, it would have been a done deal. And all of a sudden, they pulled it out, didn't want to give us that much, and they wanted to maintain those 8 people.
They wanted to maintain
They
those
wanted
8.
Those
to
8 point.
continue their fight
Their
against
fight.
paying the insurance
Those 8
for
people.
the
Okay.
benefits for those
Gotcha.
8 people.
Okay. What, when Cheryl originally asked you, what is a paraprofessional in the school system? I think you guys gave a pretty good explanation. You kind of a catch-all. What are the requirements to become a paraprofessional in school? Do you have to have special education? Obviously, you're an LPN. Obviously, you've gone to school for interpretation. Is this a college-educated type position? Because obviously, if you're an LPN, you've gone to school, extended
And I have a
school,
license that I
and you have a
maintain every year.
license, as well as yourself.
I maintain licensing.
Is that standard for all paraprofessionals? I want to get a
Depending on
job
the
as a
job.
paraprofessional.
It would depend
Depending
on
on
the
the job.
Okay.
Now, with the No Child Left Behind law, and as of January
I don't know.
it wa-
We always depend
2006.
on our UNICEF director
for
the dates and
exact
stuff.
dates.
I have no
Anybody in the
idea.
Title I programs that are the reading programs will have to have a 2-year degree, or if they're in our unit now,
They have to
we're
meet certain
negotiating
criteria.
what they need to, what kind of criteria.
And that's up in the air, what that criteria is. That was one of our negotiation fights.
Will you be able to, I guess that's my question is if No Child Left Behind dictates that there are certain paraprofessionals that will need more education than maybe they presently do in the position that they currently hold, how do you negotiate around the federal government if they're saying, okay, now the guidelines say that you need an associate's degree?
It's up to the individual district.
So the district
To decide.
can literally override the federal
Override.
government?
They can
The
say,
state,
Jeez,
I
that's
believe
new.
it's the state. I think
well, they
it's
do
the
have
state
to say
government.
that there has to be some kind of interview, some kind of criteria you meet. It's not going to be, well, Melanie, you know, whatever
We're really
you've done,
sorry,
yes,
but you didn't get
Or,
your degree
yeah,
and
you know-
you're out of here.
you know, whatever you did is good enough. No, it has to be something that they're going to agree to, that the state is going to agree to, and the district is going to provide them enough information to say, okay, you're going to meet that by doing X and Z.
And potentially giving them the time to acquire whatever.
I think we were arguing, part of what we were arguing had to do with the amount of time that they were, would we have time to do
To get the degree or
to meet
whatever.
the requirements.
Which is coming fast. They're
Think
not going
that-
to have time.
I think that was part of what we were.
Were you also negotiating,
though.
because teachers, the school district will pay for continuing education to a point for teachers and administrators. Are you also fighting for dollars for continuing education because of this No Child Left Behind, that if that is a requirement that, these people who are making $9.81 an hour now are going to have to go to school?
We have
Potentially.
similar benefits to the teachers in that if we take credits, I think it's $68.50 per credit that they will reimburse, but then there's a cap on how many of
It's
us
a
they
very-
reimburse for that. When it reaches, I think 7,500 or something. I don't even know what the.
There is,
There's
and
a cap.
we do have, and it is very limited.
Okay.
We're finding out just
It's
how limited it really is.
$7,500 for our whole unit. So, I mean, if we'd hit that cap really soon.
Really
if we
fast
had a
if we had a lot of people
lot
that
of people
needed to
doing.
meet.
And you're right, the $68.50,
Right.
no more than the cost of 12 credits. It's very similar to the teachers. We do have that,
Except
but
for
the
the
time
cap.
is expiring. There's no way they're going to get it. So we're trying to get the language in that we're going to be, that what we've done for all these years is going to be good enough for them. They're going to realize after an interview and seeing our job
Evaluations.
evaluations that we've met that. And that they can sign off on
use
us.
the job experience as
Correct.
like when they write potentially the job description, because you'll see this all the time, a degree and or applicable experience on the job. That kind of thing was what you were kind of looking for.
And many of our paras, even though the job doesn't require it as of now, even several years ago, we have many of our assistants that have 2, 3, 4 year degrees in college. They have the credits. So
We don't have the exact number, but we have a lot of
many
people
of
who
them
are
that have.
edu-
Maybe
who
they never
have the
just quite
2
finished
years
it.
plus,
Maybe they didn't get to that licensure point, but many of them have that already.
or some are teachers. You know, you get that.
Okay.
So I guess the main point here is that your main concern is that something that's already out there and has been offered for as long as paraprofessionals have probably been in existence, you don't want to see that being taken away.
Well, that's what negotiations are all about. They're give and take. We'll give you, you give us. It hasn't been that way. You know, they keep talking about these huge increases, and we're just asking for them to do the same things that they did for the NTEA, for the OEA, and for the administrators. Let's look at a package deal where we'll roll those insurance benefits that we gave up back into our. That's it. That really is it. I'm not exactly sure. I don't get the whole thing.
And years ago, yes, there were housewives that needed second jobs, and they got out there to assist in the schools, and they became assistants. It's not that way now. I mean, we have very educated people in our unit that are out there.
Very caring.
Very caring, very educated,
Qualified.
not just bored housewives needing a second job. I mean, and what are they doing? They're helping and assisting to educate our students that are going to be taking care of us in a nursing home one day. I mean, these are very important jobs. We feel that we shouldn't be left behind.
Are there places, because of the difficulties in the budgets, and administrative salaries might be a big place, that there's a problem, but when you look at the budget, are you strictly looking at your own piece of the budget, or do you look at it at the school budget in its totality when you see the millions of dollars that are going for maintenance or capital expenditures or what have you? Do you take a look at that budget in its totality and say, you know what, I can find places that we can whack the fat? You work there. Are there places that you personally and professionally can find dollars that pay for what you want here? Can you make suggestions to the school board that says, you know what, I can give you 5 ideas right now where to cut the fat that will more than pay for my benefits?
I was on a long-range staffing committee at one point. We met for hours upon hours, and that's pretty much where it was. Where can we cut? Where are you seeing the waste? What needs to be done? And it dissolved, because it got so that certain people wanted their own certain things, and it wasn't in agreement with the board. So after all those hours of discussing, and we've got books, I've got books at home of ways that we felt that we could really save in the district. It went out the door because they felt that the board didn't have enough say in it, and it was everybody's own opinions.
Is that because
didn't work.
each union is kind of
On its own.
Yeah, am I understanding that, kind of you're segregated into little groups of unions, some unions obviously bigger representation than others, but everybody's kind of looking out after their own back door, which it happens in the city too. I mean, you have the secretaries union, the professional union. I mean, there's what? I don't even know how many unions there are in the city anymore. But is that what kind of happened here? Is that everybody was afraid that you were going to cut the fat in their department?
Oh,
Don't look
everybody's
here.
looking at their backs.
Oh.
You betcha.
Don't cut
That
here.
was very difficult. I was also on a budget committee, and not the same one you were, but I mean, it was tough. You go in
So
there
you can be appreciative of how tough it's got to be a school board member, because no matter where you cut, you're going to pee somebody off.
but now tell them about what you said about the 4.2%.
We only have 5 minutes
Oh,
left too, just so that you know.
Yeah, we're
In
down
some
to
of
about 4
the
minutes by now,
information that
so-
we have gotten, the board has a pot of money that they've saved for negotiations.
They've set aside
They've
for
set
us
aside
settling.
for us, set aside for the NTA, set aside for, and we have heard that there's a 4.2%
That they've set
that they've set aside for us. So it's hard for us to say, okay, and we've made concessions. You've heard them. Now what we're going to say, okay, we give up. We're going to do the point. That's what you want. You
3.5
want. Then
package.
fine. Then fine. We're giving up. When we know they have that 4.2% out there waiting, that is in a pot, that they're, and you know what negotiations is. You know, you try as hard as you can, and they try as hard as they can to break us.
And you
Are
try
we-
and find somewhere in the middle.
In
to
the
meet.
middle, and we felt we've made that middle point. Do we now give up the rest, knowing that they have this money sitting there?
How long has your union been working without a contract? Your union members working
We're
without
in
a
our
contract?
second school year.
This
The
went
2003-2004 school year.
So that's how long this has been going on.
Yes.
Is
Till
that
well,
right?
yes. Because this went from August 24th, 2000 to the first day of work of 2003. So we've been sitting without since
The beginning of
August,
2003.
August 2003.
So when do you go into arbitration?
Well, we have to wait for the WERC to come back with their
WERC is the Wisconsin Employment Relations Commission,
which
and the district has filed two or three objections with them about language in our contract.
that has been there for years.
That has been there since the start of the contract, that all of a sudden is a problem. And we don't
Has
even know
words
what
like
the problem.
necessary.
Yeah,
layoffs.
they just. Another thing too is we talked about this. You know that costs money to file for arbitration and to go in front of WERC. They've decided to put those monies into that rather than to work with us. You know, so
It's hard for us to just say, okay, we give up. We won't do that when we know this kind of waste is going on.
Well, and then, you know, you take a look at something that the school board was looking at about a month ago, and that was to hire an outside PR firm or a consultant to help them promote their charter schools.
They have.
Oh, they did hire them now.
They have hired somebody to
Okay.
promote their schools, period.
Well-
Is that Blue Door Consulting or whatever?
I'm not positive, but I had
Sorry, that was
at
an
a
eye roll.
meeting.
That was an eye roll. I'm sorry.
Well, you know, I see. It's that kind of thing that irritates me about the way this school board is spending money. They want to try and change things that have been put out there for years, and take this away and take that away and whittle away at this. And yet, by the same token, they 2 years ago did away with a district public relations position to 2 years later only to move forward and hire a consultant because now they've got charter schools. It's asinine.
Well, I think that when we're looking at saving money, I think you look at an overall program. And that's, if you want to look at salaries and benefits, you look at everybody's salaries and benefits. And some of these administrators and some of this top heaviness in the school system, as well as the city, need to be, and then maybe we'll have money to
I
take
agree.
care of the necessities.
All right, well, on that note, thank you both very much for
Thank
being
you
here.
for your time.
Thank you.
Sincerely.
Lynn Binder and Candy Weber with the Oshkosh Paraprofessional Education Association. Thank you all for joining us and having us come into your homes this evening. We appreciate it. We'll see you next time. Until then, take good care and keep your eye on us. We've got All Right on Oshkosh.